therapist, we'll be testing the motion of your elbow. So please lay down on your back. So in the beginning, we're not going to focus too much on right and left. That will be the second practical. So I'm testing your
But
elbow
the patients
space.
always have to be laying down?
No, this is the position of elbow flexion, okay? So that's why you guys need the book. If you guys follow the book is going to have the position, and we're going to demonstrate it, what the position is going to be for every motion, okay? So we're doing range of motion again. So what we're assessing is we're assessing elbow flexion. So you can have the person, you can do, you're going to say, if you feel any pain or discomfort, please let me know. And then you can have the person, you can do a screening, right? So you can have the person, can you have your hand touch your shoulder? And you can just show the patient like this, okay? This is what I want you to do, okay? So that's your introduction. That is worth like 10, 15 points on practical. You're going to obtain 2 numbers, okay? So what you're going to do is, you can look at the alignment. This looks pretty aligned, but sometimes what happens is, the person has a little bit of elbow extension, too much elbow extension. You're just going to align the joint. You can use the towel just to prop it up a little bit. Just make sure that it's aligned. Not too much, just a little bit. Just to make the person a little bit more comfortable. Oh, like this. Okay. Now you're going to find your landmark. Okay, your landmark for elbow flexion is going to be your lateral epicondyle. How do you find your lateral epicondyle? You go into lobe flexion. You guys did palpations a little bit anatomy?
Yeah.
So this is your lateral epicondyle. Okay. So this is your lateral epicondyle. That's your axis of rotation. That's where this thing is going to be. Okay. This is your axis of rotation. This is what it's going to be. Just to remember, I want this to be at the axis. So if you feel that, that's why I used the towel, just to prop it up a little bit. You guys see what I did? Because if I take this off, what happens is, you see the axis of rotation?
No, it's not my problem.
Right, you need the axis of rotation to be at the level of the lateral epicondyle. So I need this guy over here, this thing over here should be, this is your axis of rotation, it should be at, okay. So the patient did the screening already, the patient knows what I want them to do. This is your axis of rotation, so again, you find your landmark, put the person elbow flexion, find your lateral epicondyle, okay? So we're going to go over palpations a different time, but lateral epicondyle is pretty simple to find. So you find your lateral epicondyle, you know where it is, okay, position it right over here. This is your stable arm, this is your movable arm. So if you can look at the book is going to have what the stable arm is. It's going to say lateral surface of the humerus. The movable arm, this is the movable arm, always distal, is going to be lateral to the radius. I like to use a landmark. So let's say stable arm will be pointing to the acromion, okay? Movable arm is pointing to the radial styloid, okay? So you guys can do that. So basically, you're starting at 0 degrees. Axis rotation is at lateral epicondyle. Stable arm, you guys are going to say this. Stable arm is lateral surface of humerus, so pointing to the acromion. And then you have movable arm is pointing to the radial styloid. So you can have the person, you bring your hand, can you have your hand touch your shoulder? Pick it up. That's your active range of motion. So the axis rotation didn't move, okay? My active range of motion is 0 to 140 degrees. Okay? You can have the person, can you go a little bit further? Okay, there we go. My active range of motion is 0 to 144 degrees, okay? Now you have the person, please relax, okay? And you're going to move the person. Relax, relax. Passive range of motion is 155 degrees. Those are your 2 numbers. Then you have the person relax, and you're basically going to move the person at the end joint, very gentle. The end feel is soft, so you have the muscle belly of your anterior forearm with the muscle belly of your biceps. Okay?
What do you do at the end? What do you do at the end?
You're basically trying, just basically gently moving the person at end feel a few times, and you're actually going to feel how it's basically pushing into the biceps. Okay? So that's your end feel. That's your soft end feel.
How do you know what to push into?
What?
How do you know what you're pushing into?
What do you mean? You feel it. You feel it. Initially, you're going to go through the motions, but you're going to try to feel it.
Someone who you can't go that far, how do you know when to stop and when to...
So hopefully everyone over here is okay, so you're not going to have that issues. But if anyone has any disability, anything wrong with, anything broken, anything torn, let me know.
I will do some
So this is, you guys got this? You guys are okay? We're going to review this again, but that's basically